Hello everyone, myself Dr. Maddineni Srinivas. In this video, we are going to look at the cutaneous signs seen in various infectious diseases like for example bacterial, viral, fungal, parasitic, STDs and leprosy. So let us begin our discussion with the bacterial, that two streptococcal infection associated skin findings. So the first one is scarlet fever, which is very important. So there are two findings in this. One is a strawberry tongue and the Pastias lens. So in the strawberry tongue, remember, the patients are going to have a white coated tongue initially, which are going to have the prominent papillae as you are able to see here. But ultimately the tongue is going to become red in appearance as you are able to see here. So this is a strawberry tongue. Next one is the Pastias lines, which are the petechial linear configuration which can be seen in the skin folds. Again a finding seen in the scarlet fever. Next is staphylococcal infections related hypopyoncine. So remember students, in the bullous impetigo, we are going to have accumulation of the pus in the lower half of the pustules because of the air fluid levels. This is called as hypopyoncine. And staphylococcal scarlet skin syndrome, it is associated with Nichols-Key sign. I hope all of you do remember that whenever the underlying process is acantholysis, there is going to be Nichols-Key sign. So because in staph scarlet skin syndrome, there is going to be underlying acantholysis, so Nichols-Key sign is going to be positive. What is this Nichols-Key sign? Basically, if you apply the tangential pressure, the epidermis is going to get peeled off from the underlying dermis. So this is what is called as Nichols-Key sign. Next, in the infective endocarditis, you are going to have two important findings: Janeway's lesions and Osler's nodes. Remember, Janeway's lesions are painless erythematous macules present over the palms and soles, whereas Osler's nodes are the painful purple colored nodules which are seen on the finger and the toe tips. Next, in the mycobacterial infections, lupus vulgaris, not only lupus vulgaris, other granulomatous conditions like for example sarcoidosis, cutaneous leishmaniasis are going to show one very peculiar finding on diascopy, which is apple jelly nodules. So on application of the pressure with the glass slide, the blood vascular component is going to be blanched, leading to the appearance of the granuloma in the form of yellowish brown color, and this is what is called as apple jelly sign or apple jelly nodules. Next, in the Erysipelas, remember students, Erysipelas, unlike the cellulitis, it is superficial compared to the cellulitis. So both of these are infections of the skin. Cellulitis is a deeper level of infection which can affect the subcutaneous tissues. And in the ear, the subcutaneous tissues are absent. So whenever there is an infection of the face, if there is a ear involvement, it means that that infection is due to the streptococcus. Specifically, it is what is called as million ear sign. As you are able to see here, this is a patient who is having this well defined erythematous skin, inflamed skin, and you are able to see that the pinna is also inflamed and infected. So this is going to tell us that it is a erysipelas infection rather than cellulitis. Why? Because in cellulitis, the pinna will not be involved or infected because there is no subcutaneous tissues. Next is in the typhoid fever, erythematous macules present over the trunk. These are called as rose spots. So these are the rose spots in the typhoid fever. Next is in the herpes infections, varicella, chickenpox, which is due to the varicella zoster virus primary infection. We have this dewdrop on rose petal appearance, which simply means the vesicles are present on an erythematous base, giving rise to this dewdrop on rose petal appearance. Next, we have the herpes zoster ophthalmicus. So in this, this is a reactivation of the varicella zoster virus. So whenever there is a facial involvement, remember, if there is lesion present over the tip of the nose, it is going to tell that there is going to be involvement of the eye because of the common nerve supply, nasociliary nerve, and this finding is called as Hutchinson sign. Very important, Hutchinson sign. Next, we have the measles. So remember, in the measles, we are going to have the Koplik spots. You might have read this in your pediatrics also and microbiology also. So there are going to be sand-like spots, as you are able to see here, with erythematous halo on the buccal mucosa. So these are called as Koplik spots. In rubella, Forshemer sign can be seen. So small red spots can be seen over the soft palate. Forshemer sign. Next is the Roseola infantum, in which Nagayama sign or Nagayama spot can be seen. So what is this? Erythematous papules will be seen over the soft palate and also the uvula. So Nagayama spots. In the torch infections, we are going to see this blueberry muffin sign. Basically, this is due to the non-blanchable violet red papulonodules due to the dermal erythropoiesis. So these are the non-blanchable red papulonodules which are seen in the torch infections. So if you know what is the full form of the torch, please put the full form in the comment section. And also, if you are enjoying this video, please do hit that like button, students. So next is the chikungunya fever. There is a melasma-like pigmentation which can be seen on the nose. This is what is called as a chick sign. Next, in the dengue fever, so there is going to be a confluent petechial rash with small islands of the normal skin. So this is described as white islands in a sea of red skin. White islands in a sea of red, as you are able to see here. There are small white normal colored skin in the sea of the red. Next, in the molluscum contagiosum, there is going to be one important sign which is called as BOTE sign, which simply means beginning of the end. Beginning of the end. And here it means that if there is inflammation surrounding a umbilicated dome-shaped pearly white papule, it means that it is about to get resolved, because the inflammation is going to act and the immunity is going to kill the molluscum contagiosum virus, and there is going to be resolution of the lesion. This is what is called as beginning of the end sign in molluscum contagiosum. Next, we have in the pityriasis versicolor, which is caused by Malassezia globosa and furfur. If there is a scaling which is not evident, what we can do is we can scratch the lesion, because of which the scaling will become prominent. This is what is called as scratch sign, or this is also called as Coupe d'Ongle sign, or this is also called as, with one more name, it is also called as Besnier sign. Next, in the parasites, remember bed bugs. If they are going to bite, then we can see that there is going to be a linear arrangement of the bites in small successions. So what is the reason for this? The bed bug is going to bite once in the morning, again in the afternoon, again in the night. So that is the reason why it is going to slowly progress in a linear fashion. So it is what is called as breakfast, lunch and dinner sign. Next, in the protozoan infections, cutaneous leishmaniasis, it is associated with volcano sign. So what does this volcano sign mean? So basically there is going to be ulceration of the skin, and surrounding this ulcer there is going to be this raised edges which are looking something like this edges in the volcano. So that is the reason why this is termed as volcano sign. And I hope all of you know this is a annular lesion where the center is going to be crusted in the cutaneous leishmaniasis. And if you remember, we have also discussed about cutaneous leishmaniasis association with apple jelly nodules. Next, in the African trypanosomiasis, we are going to have the posterior cervical lymph nodes enlarged, as you are able to see. This is what is called as winter bottom sign. Winter bottom sign is associated in the African trypanosomiasis, whereas in the American trypanosomiasis, which is also called as Chagas disease, there is going to be this Romanas sign, in which periorbital swelling and edema can be noted, as you are able to see here. Next, in the sexual transmitted disorders, so syphilis, remember secondary syphilis, we are going to have hyperpigmented macular lesions over the palms and the soles. And if we take a blunt end of the awl pin and if we press these lesions, there is going to be deep dermal tenderness, because of which the patient is going to have a lot of pain, tenderness. So this is called as, this demonstration of the tenderness in the patients of secondary syphilis is called as Buschke-Ollendorff sign. So here you are able to see these are the dark hyperpigmented lesions which are going to be pressed with the awl pin. Next is in the congenital syphilis, that too in the late congenital syphilis. So there is going to be a finding which is called as Higo-Minaki sign, where there is going to be enlargement of the sternal end of the clavicle. And I hope all of you do know this Hutchinson's teeth sign, which is going to be peck-shaped, notched central incisors. This is again in the congenital syphilis. And mulberry, I hope all of you know this fruit mulberry. So like the mulberry fruit, the molars are going to have so many cusps. So these are called as mulberry molars. These are called as mulberry molars. Next is there is going to be bony prominence of the forehead in the patients of the congenital syphilis. This is what is called as Olympian brow sign. Olympian brow sign. So you are able to say this is the prominence of the forehead. Olympian brow sign. In the late congenital syphilis, the shin is going to appear like a spored. So it is called as saber shin. And basically this is because of the thickening of the middle third of the tibia. Again, in the congenital syphilis, there is going to be this maxillary hypoplasia, because of which the mandible is going to appear as if it is protruding and it is larger. This is what is called as bulldog jaw sign. Bulldog jaw sign. Next, in the lymphogranuloma venereum, which is caused by Chlamydia trachomatis L1, L2, L3, there is going to be a pathognomonic sign which is called as groove sign of Grenblatt, in which because of the inguinal ligament, there is going to be a groove-like appearance in between the inguinal as well as the femoral group of lymph nodes which are enlarged. This is what is called as groove sign of Grenblatt. In leprosy, in the lepromatous leprosy, we are going to have this Hertog's sign, which is also called as Queen Anne's sign, which is basically loss of the hair in the lateral third of the eyebrows bilaterally. So here is the patient of lepromatous leprosy. You are able to see the Hertog's sign, Queen Anne's sign, which is positive. So I hope this video was helpful. Please do hit that like button if it was helpful, and you can ask anything in the comment section if you are having a doubt. Thank you so much for watching the video. Bye bye. Happy learning. Sarvam Sri Krishna Sarvajana Sukhna Bhavantu.